Before devolution, Mandera County suffered the worst World Health indicators that did not only surpass the national averages but global indicators. Mandera County recorded the worst maternal mortality rate in the world. The mortality rate stood at 3,795 deaths per 100,000 live births as compared to the national average of 488 deaths per 100,000 live births. As fate would have it, setbacks from terror attacks scared skilled health workers and made it difficult to hire experts. All this did not dim efforts of Governor Ali Roberts' administration. At the advent of devolution in March 2013, the county government inherited 53 health services in the entire county, out of which only 3 were operational at less than 10% capacity. We inherited from the national government 154 healthcare workers, many of whom lacked skills. We had 1 medical officer of health and a dilapidated ambulance serving the entire county. We had 1 theatre only at Mandera Hospital, and even that one had no proper equipment. Mandera Hospital was in a deplorable state of disrepair, and so were others in the entire county. The runaway maternal mortality rate was caused largely by lack of skilled healthcare workers, lack of equipment, frequent terror shocks that scared skilled workers away.
What was being called at that time a health facility was a one-room temporary shelter that was just called dispensary. The smallest dispensary we have today is a 5-room facility in these remote localities, which are geographically positioned strategically along the map of the county in order to make sure that we have great impact on the distance the population travel. We have also constructed an accident and emergency center with ICU, HDU, modern theater, laboratory. Is a complete hospital in itself within Elwak Referral Hospital. And that also has been completed. We are opening it together with the maternal care center. And we have an identical 2 units of the same in Mandera Referral Hospital.
Mandera County government made maternal and neonatal child health care a top priority area in the health service delivery. The county increased the number of health facilities that provide basic emergency obstetric care from 18 to 17, all operating at 100% capacity. We hired 833 skilled healthcare workers, including 34 medical officers. Mandera increased the number of facilities that provide comprehensive emergency obstetric care from 1 to 6 and improved antenatal care attendance from 30 to 75% by 2018. We increased the proportion of skilled birth attendants from 28 to 70% by 2018.
We have also partnered with Kenya Medical Training College to establish mid-level training for our staff so that we get adequate human resource for health to help us in running the health service delivery.
We've had a bit of challenge in trying to attract specialist medical doctors. We've just managed to get a gynecologist on board now, and we are planning to bridge the gap between our medical service provision in terms of, because of the environmental challenges and security and other issues that we are unable to attract specialized cadre. We want to bridge that gap by telemedicine.
We improved healthcare financing through allocation of over 21% of the total county budgetary allocation to health in the year 2017 to 2018.
We 100% support devolution of health services, especially, and we are talking about of experience. This is the real solution, and the best thing Kenyans have done was to go to devolve services, especially health services.
We procured and distributed modern obstetric equipment to all health facilities in the last 5 years. Today, we have successfully managed to get close to 80% of our health workforce as locals, which has successfully cushioned us against terror shocks and disruption of service delivery. Moreover, localizing our workforce is nothing to be proud of, since our envisaged position is to have inclusive and integrated workforce, but due to our circumstances, it is acceptable for now. The dividends paid off, and we see improvement of the reproductive, maternal, newborn, child and adolescent health indicators.
KEMRI is the only institution that can be able to help us in realizing our dream of bringing health more closer to our people, and also to support the cross-border communities from our neighboring countries.
The county of Mandera has provided space amounting to 100 acres of land to KEMRI so that we can get into this joint collaboration where KEMRI is going to establish its presence by putting up research centers, training facilities, including also treatment facilities, and even manufacturing of drugs where necessary.
Under devolution, Mandera County and Mandera'S sub-county have had their first cesarean births since independence.
Mandera County is proud to say in the last 5 years of devolution, it has midwifed over 63,000 skilled deliveries in our facilities, despite a setback of 63 maternal deaths. But this is not enough. Mandera's strategic direction in the next 5 years is to register 0 maternal deaths. Yes, Mandera can.